Mr. Hancock, a very good morning to you. We both know the drill by now. Short questions, short answers. We'll get through as much as we can in the time allotted. Here we go. From 9 o'clock this morning, 2 hours' time, if I get a knock at the door from an NHS test and trace advisor saying, I've had contact with someone who tested positive for coronavirus, must I self-isolate?
Yes, it's really important that people who are contacted by the NHS test and trace service from, as you say, 9 o'clock this morning, if you are instructed to isolate, then it's very important that you isolate, yes.
Immediately?
Yes, immediately, because the reason is that you will have been in close contact with somebody who's tested positive, and so you're at high risk.
What if I've got childcare issues?
Well, of course, it's very important that childcare is taken into account. You know, I understand that as well as anybody. And so, yes, it's very important that people deal with childcare and do that in a reasonable way.
But I need to stay at home to and organise childcare issues, yeah?
That is what you will be instructed to do, yes. And you should follow those instructions because that's in the best interests of everybody.
You understand why that might be an issue for some people?
I think, actually, the vast majority of people are going to follow what the NHS asks them to do in these circumstances, because it's not only good for them, it's also good for their community, and it helps us all to keep the R down. The whole point of this new system is to have a much more targeted approach, so that we can hold the R down and trace those new cases, and then break the train of transmission. And that, in turn, means that we can control the virus and we're safer.
I understand.
And at the same time, lift other elements of the lockdown.
But you understand that lots of people who are watching will think that it's one rule for them, one rule for us. Why should I do it if people like Dominic Cummings don't do it? So I suppose what you might have to do is make it mandatory. Is that something that you've considered?
Well, yes, we have considered making this mandatory, and there are some other countries in which it's mandatory. But in the first instance, we have great faith that the public will follow the instructions from the NHS. And my early conversations, both before we launched it and since, is that the vast majority of people will do as they are asked to do by the NHS. In the same way that if your doctor said it's very important that you go home for 14 days, then people would do that. It's that sort of conversation.
Sorry. Yeah, but how do you make it mandatory?
Well, there are powers that we took through Parliament at the start of the crisis in the Coronavirus Act to be able to mandate this. But I'd far rather not.
Sorry, I must push you on that, if I may, Health Secretary. How can you possibly, if you go to someone's house and you say you've got to stay there, unless you're monitoring them 24/7, how will you know? How can you possibly enforce that?
Well, it is, of course, all these things are new and are a challenge, but it'd be far better if we didn't have to make it mandatory. So that's why one of the reasons that we've started with it on a voluntary basis. Well, I say voluntary as in it's an instruction from the NHS, and it's very important that you do it, but it's legally not mandated at this stage, because we think it's far better, far better, if as a country we pull together and do this and everybody follows the instructions.
Problem is, you've rushed it forward, haven't you? Because you want to take the headlines away from Dominic Cummings. So you brought it forward. It should have been 1st of June when the app is being launched at the same time. Then with the app, what you could have done is if people go out, they have to have a GPS on their phone, and they get a call or whatever, a text every 6 or 7 hours like they do in Singapore. But you've had to rush it forward. It's
priceless, Kay. I'm normally accused of delaying these things and bringing them in too slowly. I committed to getting the system in mid-May.
You did.
No.
You talked about the app in mid-May. Okay. You talked about the app. You talked about the app in mid-May, didn't you, Health Secretary? And we've still not got that app. You said the app was absolutely essential to this track and trace. The app is still not ready until next week at the earliest, maybe after that, and yet you brought this forward. I suppose many of my viewers will think it's not a laughing matter.
Yes, well, I can't quite work out whether you're telling me that I've gone too slow or too fast. I think we've gone at just.
I tell you what, I don't think my viewers know. I think they're as confused as I am. Clarify it for us.
Yeah. Well, we brought it in at just the right speed. And the crucial thing with the app is helpful. It's working on the Isle of Wight, but there's a reason that we haven't brought it in right at the start, which is that
Why?
Asking people to isolate, even if they're healthy, because the NHS has got in contact and informed them that they're at higher risk because they've been in contact with somebody who's tested positive. That is quite a big change. And one of the things we learnt in the pilot on the Isle of Wight is that getting people used to that idea is important to do before we then also add the technological capability, the app, on top.
Yeah, but you thought you could do that by mid-May, and you haven't. And so you're having to delay it, but you're rushing in other parts of it rather than launching it all properly together, I suppose, is what my viewers might be shouting at the screen this morning.
I doubt that many people will be shouting at the screen that I have rushed it and delayed it in one question. But anyway, I'll try to answer it best as I can. The pilot on the Isle of Wight showed that the best thing to do was to introduce the contact tracing, the human contact tracing, and then build on that once people have got used to the idea that when the NHS test and trace system gets in contact, you've got to do quite a big thing, which is to isolate for 2 weeks. Now, the app adds value to this system because it can help to find contacts who you simply wouldn't be able to find any other way. So, if you were on a bus, say, within 2 meters of somebody, you wouldn't know that you were within 2 meters. You wouldn't know who they were. You wouldn't be able to contact them, but the app will help do that. So the app helps. As Baroness Harding, who's running the programme, said, it puts the cherry on the cake. It isn't the cake. Okay,
I'm glad we're clear about that, I think. You have had coronavirus. Does that mean that you don't have to self-isolate?
No. The science says that there is a likelihood that those of us who've had it have a lower risk, but we are not yet confident in that. And we're currently doing the research to find out if it's true that those of us who've had it can't transmit it. Because it's not only a matter of those of us who've had it not getting symptoms again, it's very important that we don't transmit it asymptomatically as well. Okay,
what also might be not very amusing for people is if they go on the London Tube or somewhere else where it's really busy, and then they get somebody at the door saying you're going to have to self-isolate because you've been in touch with, in close proximity within 2 meters of somebody who's had it. You do that for 2 weeks, you go back to work, you get another call. You do it for 2 weeks, you go back to work, you get another call. That could happen.
It could, and that is part of life. And
who's going to pay? Who's going to pay their wages when that happens? Are you asking employers to step in?
Yes.
What if they don't?
Well, of course, there's a legal system around that because you are legally equivalent to being off ill. And we brought that in right at the start.
There's a limit on sick pay, as we know. But would you make that mandatory as well?
Well, yes, the employment law covers this, and we changed the law a couple of months ago so that if you are instructed by the NHS for public health reasons to stay at home, then that's the equivalent in employment law to being ill. It's very important that employers are flexible around this.
How quickly are we going to get these test results back? At the moment, it looks like it's several days. The Prime Minister said yesterday that he expects it to be 24 hours. He was pressed during the liaison committee for how long before that is the case. He says he's been forbidden to tell us. He can't make any more deadlines. He's the actual Prime Minister, but he can't tell us. Perhaps you can.
I can. 84% of the tests from the drive-through centres are returned within 24 hours. 95% of all tests are returned within 48 hours. Of course, there are examples of where the process hasn't worked, because this is now a massive process. And there are individual stray examples. We're working all the time to make it faster. I want to see every test returned within 24 hours from those drive-through centres, and we will do that just as quickly as we can. We've brought down the return time.
The Prime Minister didn't tell us that yesterday.
Well, what he did was he set me a goal of all tests from the drive-through centres being returned within 24 hours. So his job is to set the goals, and my job is to meet them.
OK, he said he can't set deadlines, but there we go. What did you make of his performance yesterday at the liaison committee?
Well, I think he was very clear and solid. And the crucial thing
is
that, and the crucial thing is that we look forward to how we can take the next stages, the next steps, and take this country forward. And I think the large majority of what he was talking about was about that.
Okay, a couple of questions before I let you go. I know we're almost out of time. Professor Whitty and Professor Vallance, we saw them arriving on Sunday and we were told that they were going to do the news conference at number 10 Downing Street. Then they were in a little while. Then we heard from Mr. Cummings in the Rose Garden, and then they left and somebody else did it. We haven't seen them since. When are we going to see them at the podium again?
Oh, well, I'm sure that they'll be at the podium soon. I mean, they've both played an absolutely incredible role in advising the...
Sure. No problem. Both... Okay, great. Thanks for clearing that up. Forgive me, because there's been a lot of speculation about that in the press, but we've heard it from you. And of course, you are the Health Secretary and you've cleared that up. Thank you. What about what Penny Mordaunt and also Sajid Javid, two of your former colleagues, one still a colleague, one a former colleague, saying, one of them saying that it's time for Dominic Cummings to go, the other one saying that he should apologise. Why are they both wrong?
Well, I don't agree with them, obviously, on this. And what really matters, I think, is that we take forward the next stage of how the country can deal with coronavirus. And that's what the new NHS test and trace system is all about, having a more targeted version of being able to target who has to isolate rather than having these blanket rules across all of us, which are having the enormous impact that they are. Today, I have to formally review the rules on lockdown, and you'll be hearing later about the conclusions of that. We're doing everything we possibly can to get this country back on our feet, and that is the absolute focus of our attention.
You were giving me straight answers till we started talking about Dominic Cummings, and then we drift off again.
Well, it's about the future. It's about the future, Kay, and what we're doing to get this country out of this mess.
And every single one of my viewers is doing their bit. Yeah, it's doing their bit. Just to sum up, before we let you go, from today, you could get a knock at the door. You have to self-isolate for 14 days. You could go back to work. It could happen multiple times. It's voluntary for now. If you don't, it will become mandatory. We haven't decided when and how that might happen. The app that should go with this isn't quite ready yet, but it should be ready next week.
The app is ready. We're choosing to bring it in later, Kay. I mean, we can go through this again and again.
That's why I was clarifying. Just so.
Yeah. But other than that, what you said was broadly right. Yeah. The key thing for everybody watching is, one, if you have symptoms, please go and get a test. And two, if you test positive and if the NHS then calls your contact, if you get that contact from the NHS test and trace system, asked to isolate for 2 weeks, then it's very, very important that you do.
OK, Her Majesty behind you. Do you think she'd approve?
I very much hope that she would. I think formally she approves of everything that's done in her name in Her Majesty's government, and we're all doing our best.
Indeed so. It's good to talk to you. Thank you very much indeed for joining us. Thank you.